Last week, I had an appointment at the Joslin Center to have a conversation, or at least a meeting, with the people who help me to keep my glucose in order because I'm diabetic. And it started out where you have, well, the nurse who comes in and he does the things where, you stand on the thing and they check your weight. They, stick your finger. And he knows that I'm now using the Dexcom G7 and he wanted to see what the numbers look like. He said, so you're connected to the phone? I said, no, I'm not connected to the phone. I mean, I'm connected to the phone, but I'm not connected to their system. I said, no, I don't know that I necessarily want to do that. So anyhow, I show him the phone, show him the number, and he says, well, it looks like it's going down. I said, yeah, it is going down. And I'm a little off right now. I'm not really sure why. And of all things, even though I hadn't crashed, it was going down. And so he got me some of those little peanut butter crackers, which, those are not bad. Got me that, got this little thing of apple juice just so that I would make it through the appointment. Obviously, I'd have to go eat something after that, but, there we go. So now the nurse practitioner comes in. Like I said, I'm not sure if she's a nurse practitioner, nurse manager. I don't know what her title is. One of these years, I'll look it up. Anyway, I've been dealing with her for a whole bunch of years. Often, I've gotten good information from her. This time, I didn't get good information from her. As a matter of fact, it was almost like it was a battle because I wanted to tell her what had gone on with the physician, what had gone on with the medication, and she's reading certain notes. And one of those things everyone needs to know this about physicians is that they do not write down everything that happens when you have an appointment with them. It's all medical stuff, but they don't have everything else, which basically means that when you see them the next time, or someone else sees you the next time and they're reading what the previous person wrote, they don't have all the details. So anyway, she's saying all this stuff. She says, well, why aren't you on Trulicity anymore? I said, it's right there in the record. And she said, well, it's not really there any longer. I said, oh, Jesus. So I tell her why I'm not on Trulicity. And I said that, one of the problems I had is that I had a couple of days where I didn't eat. I didn't eat anything at all. I dropped like 4 or 5 pounds quick. And she said, well, not eating isn't a bad thing. I'm like, what? That basically started the debate. So that irked me. Then I told her what I was doing. I'm taking my Novolin with the Lantus. Well, you can't do that. Why not? I said, I called and they wanted me to do another week's test. I had just done one 2 weeks earlier. So no one was telling me anything. I started taking it because now that I'm not taking the Trulicity, the Lantus didn't seem to be doing anything. She says, well, you shouldn't just start doing something. I said, I called. I sent something through the portal. No one responded to me. So she was bothered by that. Then we start talking about some of these other things. Why I should be hooked up through my phone with their system and all this other kind of stuff. I said, no one has ever told me anything. I know that you mentioned this last time, and that was before I started using the freestyle way back when. And I said, I want to see what this is like before I start doing anything. But I wanted to tell her my story. I said, look, wait, you keep jumping in. You're not letting me tell my thing. I'm the patient. Let me tell my thing. So I basically get a minute and a half into the thing, and now she wants to cut in. I said, how are we going to do this? How are we going to have this conversation? You're not listening to me. I'm listening to you, but I'm also trying to tell you what I've done, and you're not listening to me. And they didn't write any notes. It was contentious. This is probably one of the worst visits I've ever had. And I could tell she was getting frustrated. She could probably tell I was getting frustrated because I was holding my voice down. And I didn't like it. And eventually we got to a point where she said, would you like to meet with an educator? I'm thinking, wait, I did that back in, 2012. I had an educator and she was no good. But it's 12 years later. Maybe we'll have a good conversation. And later on, when I thought about it, I said, I did have an appointment with the educator after I had my appointment, like I'll say, 3 months earlier. And she's the one who showed me how to use the freestyle. So there you go. Anyway, I said, sure, let's do that. And she said, well, would you like to talk to a nutritionist? Well, then I started thinking, no, actually, you know what? It was the nutritionist I had the appointment with back in 2012 when she had no clue on how I should do anything because I had high potassium and she didn't know what I could eat or what I should eat to have lower potassium. I mean, you know, because most people have low potassium and they're trying to get it higher. So, you know, I don't follow the rules even in a different way. Anyhow, we get to a point where I've got an appointment with the nutritionist and the educator on the exact same day. I think it's the 10th, which is a Tuesday, because, you know, I work a job from Wednesdays through Fridays. So we set that up. And then we talked about the Lantus. And she says, well, do you want to stop the Lantus? I said, the Lantus isn't doing anything. You don't want me to take the Lantus with the Novolin? I've got some Novolin pills. So, I mean, you know, not pills. What are they? Applicators. So I still have these. And she said, then let's stop taking the Lantus. Fine by me, because I didn't think that was doing anything in the first place. So now I am on the Novolin, taking it twice a day, 20 units, although I started off with 10 because I wanted to see, you know, if it was going to do anything before I moved up to the 20. Because the reason that all of this stuff started was because I was having a bunch of crashes all the time. And it turns out that's a lot worse than you would think it would be. But it was just so frustrating. You need to have physicians who will take the time to talk to you. When I met with my primary care physician and we were talking about taking me off of the pravastatin for a while because I was just exhausted all the time, and a friend of mine had the same thing, although he's not diabetic. He has, you know, different issues, but he was taking a statin and that was making him really tired. His doctor took him off and he was fine. I said, you know, primary. But see, it's easier talking to a primary care physician, which isn't always the case, but in this case, it is. So he was easy to talk to. When I talked to the doctor, I didn't really talk to her. She basically talked for 2 hours, and I didn't really offer much because I hadn't seen her in over 2 years. Sometimes you just have to know when to stand up for yourself. So that's what I tried to do. Now I'm going to see some other people. I'm going to make sure that they get to hear what I have to say, because obviously no one's going to have any information on me from back in 2012. I know that because I did a search through my records on their online system, and the furthest back it goes is 2017. So they have no clue what anyone else said. They had no idea that the reason I started taking the Novolin in the first place from Walmart was because the doctor there said I should do it. So, you know, like, what made you do that? Because your doctor said that when she was here. I don't know. Anyway, this is just a quick update. I hope it's quick anyway. Yeah, it's under 10 minutes still. You just have to find someone who will listen to you. You know, you have to take that opportunity to say something, get people to listen to you, to work with you. And if you need to talk to someone else, maybe you will be in a situation where they'll have some kind of nutritionist or some kind of educator who you can talk to. They're freer with their time. They will talk. We'll see how it goes. Anyway, frustrated Mitch Mitchell. That's me. I just wanted to, you know, put this out there. Let me know what you guys think. If you've had some of these similar problems, you take care.